guys, I want to talk to you about a condition we're seeing in the clinic a lot lately, which is pain on the outside of your hip. We're seeing it a lot lately because people are starting to do a little bit more walking, or maybe they've done a few stair runs. Otherwise, typically common in clients that have gained a little bit more weight in recent times. It's more common in women than men just due to the shape of our hips. And what patients typically notice is they're getting a really bad kind of pain over that outside of their hip in the middle of the night when they're lying on that side, and first thing in the morning when they're taking those first few steps. So what I want to talk to you about today is just a few things that we can do to change that pain and some exercises you can do at home. The first thing I want to talk to you about is some ways that you can help to reduce your pain throughout the day. So what we typically see is that people that stand on the outside of their hip, so they hang off their hip like this, or maybe they stand forward like this. So some really quick and easy ways just throughout the day is, rather than standing in this position, just to make sure that you're more upright, and the same that if you tend to lean forward, just to think about bringing the weight back on your heels. Otherwise, in sitting, women often cross their legs like this or like that, which just increases that compression force of the tendon against the bone, which is just making the pain worse. So when you're sitting at work, make sure that your knees are directly in line with your hips to decrease that compression. So we're going to start with a squat and hold exercise. So we're going to squat down, which has been shown to take the pressure off the tendon, and then we're going to use a towel underneath our heels because lots of people have really tight calves which prevent them from squatting. And then we're going to stay down here for about 20 seconds times 5, making sure it's pain-free and making sure we're thinking about tearing a piece of paper so that our legs stay out. All right, so the second exercise we're going to do is a bridge. So to start with, you're going to think about lifting up through your feet, so your heels are the only thing you're pushing through, and then you're going to lift up into a bridge, and you're going to think about tearing a piece of paper with your legs so that your knees track over your second toe, which keeps your glutes on, and then you're going to hold this for about 20 to 30 seconds times 5.